Good morning and welcome to Breakfast Show on Radio Nigeria, Coal City 929 FM, Enugu. I'm your host, Ekene Odigwe. Thank you for joining us today as we focus on an important issue that affects millions of people, but is often overlooked in planning and development conversations. Disability data. When government and organizations design policies, allocate budgets, or plan social services, they rely heavily on data. But what happens when the data does not fully capture the realities of persons with disabilities? When disability statistics are incomplete or inaccurate, policies may miss the mark. Resources may not reach those who need them the most, and development may leave some people behind. Across many communities, there are still gaps in information about how many persons with disabilities live there, the types of disabilities they experience, and the barriers they face either in education, employment, healthcare, and everyday life. Now, without reliable data, it becomes difficult to plan inclusive schools, accessible infrastructure, or effective social protection programs. And that is why today we will explore why improving disability data is critical for inclusive development and what can be done to ensure persons with disabilities are properly counted and represented in national and local data systems. To guide this conversation, I am joined by two advocates working closely with the disability community. First is Comrade Onyebuchi Mba, Chairman of the Joint National Association of Persons with Disabilities, JONAPWD, in Enugu State, and Member Enugu State Persons with Disabilities Commission. And also with us is Chiamaka Ohalete, Financial Secretary of JONAPWD in Enugu State. Thank you both for joining us today.
Thank you for having me.
Thank you. I am glad to be part of this conversation.
To begin the conversation, Comrade Onyebuchi Mba, let me begin with you. Many people hear the phrase disability data, but may not fully understand what it means in practical terms. From your perspective, working with persons with disabilities, what exactly is disability data and why is it so important for development planning?
Disability data is simply referred to as the statistical information about individuals with disabilities, which include their prevailing situations, types of disabilities, access to support services, and other socio-economic opportunities available in the society. Reliable and accurate disability data helps in development plan. It enables the policymakers understand the needs of individuals with disabilities, identify the gaps in support services, and allocate resources effectively in order to ameliorate their plight. With accurate disability data, the policymakers develop and design inclusive plan that caters for the needs of the citizens, regardless of abilities. It promotes socio-economic inclusion, thereby enhancing egalitarian and equitable society for all.
When data about persons with disabilities is incomplete and outdated, it can create a situation where policies are based on assumptions rather than evidence, as you can see in my introduction. This sometimes leads to programs that look good on paper but do not address the real needs. From your experience, Chiamaka, within the disability community, what are some of the common gaps or challenges when it comes to collecting accurate data about persons with disabilities?
From my experience and also as someone that is actively engaged in the disability community, I would say that one of the biggest challenges with disability data is underreporting. Many persons with disabilities are simply not captured in the census or in official systems, especially in rural or underserved communities. So this is often due to stigma, lack of awareness. Sometimes there is awareness, but when it's not in the in an inclusive manner, persons with disabilities, especially the deaf and the people in underserved communities, they are left out. And sometimes the fear of discrimination too, because many times people taking or doing the data collection are not trained on inclusive way of collecting data, and that can often lead to discriminating against persons with disabilities, and the fear of it can make a person with disability not present his or herself in the data collection. Another gap is outdated data. Disability is not static. I know for years now we've been estimating on a particular number. People acquire disabilities over time, but when the data is not updated regularly, it fails to reflect current realities, and that will make planning ineffective. There is also another issue of data classification. Disability is often grouped broadly. Yes, we have the deaf, the blind, the physically challenged, the persons on the wheelchair, that's spinal cord injury. We group them broadly, but we didn't capture the specific needs. For instance, as an amputee, my need may not necessarily be financial support, but accessible infrastructure, ramps, walkways, and inclusive facilities. When this level of detail is missing in any data collection, planning becomes misaligned. So my take on this is very simple. When data is incomplete, inclusion becomes accidental and often ineffective.
Another concern raised by advocates is that many persons with disabilities are not counted during surveys or census due to stigma, lack of awareness, or the absence of accessible data collection methods. Comrade Mba, in practical terms, how does the lack of accurate disability data affect policies and services such as education, employment opportunities, healthcare, or social protection programs?
The lack of accurate disability data statistics has far-reaching consequences, which include inadequate resource allocation, ineffective policies, limited access to services, stigmatization, and exclusion. In explaining this further, government without accurate disability data finds it difficult in prioritizing issues affecting persons with disabilities, finds it difficult in promoting disability inclusive budgeting. This is another way of leaving them on the dark other than sustainable development for all. Ineffective policies also do not in any way cater for the needs of persons with disabilities. That is more reason why there is need for accurate disability data in order to ensure that individuals with disabilities enjoy policies and programs that speak directly to their peculiarities. Limited access to services is also another challenge or challenges that excludes individuals with disabilities from quality education, health services, employment opportunities, etc. Exclusion all over, including the use of public facilities. The limited access to services all over affect persons with disabilities in a manner that left them on the side of pity. This issue of data also affect persons with disabilities by the way of promoting stigmatization and exclusion towards individuals with disabilities from families, villages, towns, communities, and all over, particularly in our Nigerian society. So the challenges of not having an accurate data statistics are numerous and cannot be overemphasized, particularly to the community of persons with disabilities.
Inclusive development means ensuring that everyone, including persons with disabilities, benefits from national progress, but inclusion cannot happen effectively without evidence that reflects real situations. Over to you, Chiamaka. What role can organizations like yours, JONAPWD, play in helping government agencies and development partners gather more reliable and inclusive disability data?
So organizations like ours, that's the Joint National Association of Persons with Disabilities, will play a critical role if fully involved in terms of bridging the gap between persons with disabilities and policymakers. Because we are made up of people with disabilities, we interact, we have direct access to the lived experiences and grassroots realities of what persons with disabilities face. So it makes it easier to gather data that truly reflects what people face daily, and to also reach persons with disabilities at the grassroots, because many of them are in the far-flung locations where even the data collection personnel, sometimes they don't reach. So when JONAPWD are involved, they help to reach the unreached. They can also support government agencies in designing the tool, make it inclusive, have an inclusive data collection tools that can go beyond asking or even looking at somebody to tick the category of the disability, but to also ask further on the barriers faced and the needs. So we can also play a strong advocacy role, ensuring that disability data is prioritized in national planning and not just collecting data. It is prioritized and it's aligned with inclusive standards. And most importantly, we will help build trust within the communities, because of the things happening in the world, sometimes persons with disabilities will feel, they are coming to use it to make money. So, but when we are involved, it helps to build trust within the community, and it will encourage more people to come forward and be counted. Because when people are counted, they are considered. So JONAPWD will play a huge role, help to turn disability data from numbers into meaningful action. Thank you.
All right. This is Breakfast Show on Radio Nigeria, Coal City 99 FM. And today on the program, we are talking about improving disability data for better policies and why accurate disability data matters for inclusive development. Our guests are Comrade Onyebuchi Mba, Chairman, Joint National Association of Persons with Disabilities, JONAPWD, Enugu State, and Member Enugu State Persons with Disabilities Commission, and Chiamaka Ohalete, Financial Secretary, Joint National Association of Persons with Disabilities, JONAPWD, Enugu State. And remember, you can join the conversation online on coalcityfm929.net.ng. Now, technology is also changing how data is collected around the world, from digital surveys to community-based data gathering approaches. For you, Comrade Mba, looking ahead, what practical steps should government, researchers, and civil society organizations take to improve disability data collection so that policies become more responsive and inclusive?
To improve disability data collection, government, researchers, and civil society organizations should adopt inclusive disability collection method using digital survey and community-based approach. The Washington Group Shot Set should also be used as the non-standardized disability question. It is also good that data collected should be the basis of policy formulation. That is to say that the numbers, the information, the statistics as collated should serve the purpose of ensuring the sustainable development for all. Again, the authority should also ensure data disaggregation by disability, sex, age, and other relevant factors. The persons with disabilities themselves should also be recruited into disability data collection, as it is often said that he who wears the shoe knows where it pinches. There should also be training and retraining of the disability data collectors on awareness and inclusive best practices, as it is in the international designed principle.
Beyond government agencies, communities themselves also have a role to play in recognizing and supporting persons with disabilities. Chiamaka, what can community leaders, families, and the general public do to ensure persons with disabilities are visible in data systems and included in development planning?
So the role of the community and, of course, the family. The communities that persons with disabilities live in are central. They are very key in ensuring that persons with disabilities are visible and counted. Community leaders the word must, have or create a safe and inclusive environment for their persons with disabilities so that they will feel comfortable in making themselves available. So in many cases, like we know, stigma that persons with disabilities faced in their own community can lead to them hiding, which means they are never captured in data system, because when you are hiding, you cannot come out. And sometimes that stigma will even make the community not to even give the accurate information of who and where persons with disabilities in their community live. So families also play a vital role, because we need to ensure that people with disabilities are registered. They get information in most cases more than their children or their siblings with disabilities. So they have their own role to play, ensuring that persons with disabilities are registered, be it in the school, in the healthcare system, social programs, however the government designed the data collection. So they will help to make people with disabilities within their homes visible in the data collection. So the general public is not left out. They must also shift that perception. Because some will be like, data collection, just give them money. That's fine. So they need to shift that perception. When disability is seen as part of human diversity, and which we keep saying is part of the human diversity, when it is seen that way, inclusion becomes intentional. Nobody will be left out. Nobody will be stigmatized. And participation in data process will be explicit, like very seamless, both for persons with disabilities and the people collecting the data.
Before we conclude, it is important to remember that better disability data is not just about numbers. It's about visibility, dignity, and equal opportunity. Finally, what key message would you like policymakers and the public to take away from this conversation on the importance of accurate disability data for building a truly inclusive society? Let me begin with you, Comrade Mba.
Key messages to the public. Accurate disability data is not just in number. It is all about recognizing that persons with disabilities are humans and deserve equal treatments. It is about promoting the dignity of man. It is about making every life count. It is about promoting inclusive society and sustainable development for all, regardless of disability or ability. Finally, to the policymakers and the general public, the need for accurate disability data cannot be overemphasized, as persons with disabilities are part and parcel of the society. They deserve equal rights, equal opportunities. They deserve equal treatments. They deserve dignity. We should join hands in synergy to prioritize issues affecting persons with disabilities, from our immediate families to the villages, communities, and to the state actors. Issues affecting persons with disabilities across states should become an institutional-based matter other than a charity-based issues. Religious leaders, traditional rulers, civil society organizations, stakeholders, persons with disabilities themselves, every individual in the society should promote the interest of and matters affecting persons with disabilities. We encourage every individual, families, leaders at different levels in our society to join hands in ensuring that we give voice to the voiceless. Disability is a thing of nature, and we are all potentially disabled. It is one today, it can be another tomorrow. Thank you for having me. Thank you, the listener, and thank you, Radio Nigeria, for your disability-friendly dispositions at all times. Thank you, and God bless you for this wonderful opportunity.
So my key message is that disability data is not just about numbers. It's not about how many persons have disability in Enugu, in Kano East, in Udi. No. It is about the visibility that we create, the dignity and the equal opportunity that comes out from planning with data. As an amputee, I understand what it means to navigate systems that are not always designed with my need in mind. It's not always designed for a person with physical disability to access. So when the data does not reflect real experiences of persons with disabilities, policies and programs, of course, we know, must fall short. So accurate data helps us to move from assumptions to solutions. Yes, it also ensures that what we plan is targeted and inclusion is practical, not just theory. Oh, we are including persons with disabilities, but in actual sense, persons with disabilities are not getting the dividend of the inclusion that you are doing. So without data, inclusion becomes just a guesswork. It just becomes a paper thing. And guesswork often leads to exclusion. We know that because when it comes to the reality, people are excluded. So I encourage the public to prioritize accurate and inclusive disability data because there is no doubt when we count everyone, we can plan for everyone. So my final takeaway will be an inclusive society is not built by chance at all. It is built on data that reflects every voice. Thank you so much.
And that's wonderful, Chiamaka. Thank you very much, Comrade Onyebuchi Mba, Chairman of the Joint National Association of Persons with Disabilities, Enugu State, and Member Enugu State Persons with Disabilities Commission, and Chiamaka Ohalete, Financial Secretary of the Association, JONAPWD in Enugu State, for sharing your insights on this important issue. Improving disability data is a viable step towards ensuring that no one is left behind in development. When persons with disabilities are counted, their needs can be better understood and policies can be designed to promote accessibility, inclusion, and equal opportunity for all. All right? Thank you for listening. Until next time, stay informed and stay engaged. Producer has been Jude Obu. Supervisor is General Manager, Coast City 99 FM. Kate Nebo. The Executive Producer is the Zonal Director, FRCN, Enugu Zonal Station, Dr. Ikechukweze. And my name is Ekene Odigwe. And this has been The Breakfast Show on Coast City FM 99. Good morning.